I think we'll get started. I'm John Hyatt, Vice Dean for Faculty in the School of Medicine, and this is a program that we do annually, and really an outstanding one. We do it around this time of year, and I really appreciate the participants, the speakers who I'm going to introduce very briefly. I could spend the whole hour introducing these folks, but so we can hear their presentation, I'm going to go relatively quickly, and I'm going to introduce them alphabetically. They are Dr. Stephen Dubinett, who is Associate Vice Chancellor for Research in the university, Senior Associate Dean for Translational Research in the school, and Professor of Medicine and Molecular and Medical Pharmacology, and Director of the Clinical Translational Science Institute, and Chief of Pulmonary and Critical Care Medicine. We also have Ms. Robin Faria, who's Director of Operations for the Grant Submission Unit of the CTSI, and Dr. Stephen Smale, who is Vice Dean for Research in the School of Medicine and Professor in the Department of MIMG. I believe we're going to lead off with Dr. Dubinett, and I will turn it over to him. Steve, you're muted.
Thank you, Dr. Hyatt, and I will begin by sharing this screen.
There we go. Good.
Glad to have a few moments to speak with you about research funding, and I'll begin with some comments that are general, that I think apply to many different fields. This will be followed by Robin's presentation about her work in the CTSI and the Grant Submission Unit, and some very practical things about what is actually available to our faculty, particularly junior faculty, getting started. There are some really basic principles in regard to how we should approach writing a grant, and I've divided this into certain key specific 10 areas that we'll discuss. But to begin with, we should keep in mind that most of the funding agencies have these specific criteria. These are the NIH criteria for reviewers. And many of the funding agencies have adopted this or some format of it. And so I'll briefly mention these 5 areas and what needs to really be highlighted. So as a reviewer, and if I'm on study section, I need to summarize these points about your proposal, beginning with significance. Almost everyone I know in the School of Medicine, whether they're studying an intracellular molecular pathway all the way through to community research and implementation science in the community and in populations, are studying something that's relevant to a disease. And so it's important, however, to define the specific work that you're doing as being significant within that domain. And the example I always use is from my field. I suggest that our trainees and junior faculty say more than the fact that lung cancer is the leading cause of cancer death in the United States and the world, and that is that we want to talk specifically about that clinical need that we're addressing within the lung cancer spectrum. And so I think that's true across the disease states. In terms of the investigator, this is a judgment of you as the principal investigator, and we'll talk about this as we go through, but I think you want to be entirely positive in the description of what you've accomplished, and recognizing when you're applying for either your first R01 or K award, that this at times will not be the amount of experience or publications, obviously, that you have later in your career, but it's important to emphasize being positive about those experiences and those achievements that you have. Innovation is important, and knowing whether you're being innovative requires you to know the literature, as we'll talk about, relevant to the field you're utilizing. The approach is one that includes the techniques that you'll use to address your hypothesis. And this needs to be logical in its approach and consistent with your specific aims. The environment at UCLA in almost every circumstance is outstanding, and so you want to make sure that you get an outstanding score in the environment. So the first 5 things of the top 10 requirements are organizing your goals and priorities that we'll talk about, choosing your funding agency, knowing your audience, speaking with the program officer, being up to date on the literature, as we mentioned, and establishing collaborations. Being aware of the overly ambitious pitfall, the easiest thing for a reviewer to say, we'll talk about that. Respond to and learn from the critiques, advertise your results to leaders in the field. We don't often think about this, but in fact, your proposal is read by a room full of individuals who have expertise in your field, and it is an advertisement. And so, and then finally writing a proposal as a creative work that's inseparable from your ongoing research and learning to enjoy the process. So in organizing overall goals and priorities, it's really important to establish a hypothesis and state it clearly. And even if we're doing something that involves omics and sequencing, where we have, where much of some of the work may be hypothesis generating, we need to be able to point to something that's a hypothesis, even if it's a simplistic one. This is important in terms of having senior people and your mentor help you in drafting your proposal. So I suggest to people that they consider that first specific aims page before they launch into writing many pages and showing that to a mentor. I think the thing that's most instructive is to begin with that first page. Consider your specific aims as you move along to really be written on a whiteboard, that you're willing to make them totally malleable in service of writing a good proposal. Because if you start with aims that have some flaw in it, there's no way to fix it in the subsequent pages. Choosing the funding agencies and knowing the audience is important. It's possible and advisable that you look at the study section, who's on it, be familiar with what they do. There is a pitfall in applying to the study section in which there are experts who are working in your field and not referencing their work. So be careful to do that. One obviously has to follow the requirements exactly. And I call thinking outside the NIH box as looking for other opportunities and funding agencies. And I've just listed a few, but there are dozens and hundreds of opportunities outside of the NIH, including other funding agencies in the federal government. We have foundations, industry. California has a number of state opportunities, and of course, institutional funding at UCLA. Now, this communication that you have with the NIH is via a program officer whose name is listed on a request for applications or a funding opportunity announcement. You can often have valuable guidance from them, and they're always, part of their job is to speak to you, particularly as a junior investigator, so that you understand the scope of their study section, and they can really give you valuable advice up front as you apply for the first time, and especially when you need to apply with a revised application. So being up to date with the literature, it does seem obvious, but I should state it, and that is the only way that I know that I have a new idea is to know what others have done. So writing a proposal is the opportunity in which some of us learn the most in writing those proposals, because we have to be knowledgeable about what's been done. And I think that this is one of the good things about proposal writing is not only to receive that funding, but to learn as you go. Establishing collaborations is key, and a friend shared these pictures with me to contrast the group on the left working together versus the competition of battling. And so the vast majority of what we do now is collaborative in the sense that the complexity of all of the work in all of the fields has grown, as have the technologies. One example of this is essentially all of the things, the funding mechanisms that I'm now directing include a multi-principal investigator plan. That is, there's more than one principal investigator. This allows you to do so much more. It doesn't really happen anymore that we operate really entirely individually. And so there are great opportunities both at UCLA to collaborate as well as at other institutions. And I recommend that highly. It strengthens your proposals. Now, one of the things that's a frequent complaint of reviewers is something is too ambitious. And I certainly got this complaint from reviewers when I started out because I thought I had a lot of good ideas and I would put them all into one proposal, and that doesn't work out well. And so I think this is one of the advantages of having you review your specific aims and your proposal with senior people in your field, because you want to actually be focused in your approach. And that requires having a theme, sticking to it. The other point about this is that I always include a section at the end of the approach, or you can do it by each aim, and that is called anticipated problems and alternative plans. I also sometimes put in there alternative and future plans. This is a way in which you can let the study section know that you could think on your feet and be able to change and be flexible depending upon what your results are and problems that arise. I recommend not saying we don't anticipate any problems because we're familiar with these techniques. And obviously, any of us who have done research for a period of time in any field will know that obstacles arise that we can't anticipate and need to be able to be flexible. So learning from the critiques and responding to them. Everyone gets a rejection. And I've not yet met anyone in the past 30 years who has done this for any length of time and not received some rejection. So we have to build into what we do a plan to respond to those critiques. And so this is extremely important because your response to that critique really sets the stage for having an accepted proposal in response to that revision. So the part up front, which is now called the introduction, needs to be concise and cover all of the points raised by the reviewers. People often ask me, what if the reviewers are wrong? This happens not infrequently. So it's important not to criticize the reviewers and tell them how wrong they are overtly. I think it's always good to start out with being appreciative, and this is kind of what I say in the front of every response to critique, is that we've thoroughly revised the proposal in accord with their suggestions, and we appreciate their comments. In the past, they used to suggest that you indicate where you've changed the proposal. They don't do that anymore. But if you just say our response to each of the reviewers' comments is summarized below, making sure that they recognize we're paying attention to what they're doing. when I've been on study sections, I've never seen it be a good strategy to tell the reviewers how foolish they are. It just doesn't work very well. Now, responding to the critiques should be something that is thoroughly obvious to them and immediately accessible in terms of what you've done. And what I'd like to do is go through the summary statement, make a list of each of the criticisms, and then respond to that as the first thing that we're doing, and making sure that we're covering each thing in the revised proposals. It's important to get advice about this, and although people don't generally announce this from the podium in terms of how many rejections they've received, I can tell you that I've received quite a few. And so I have experience in responding to the critiques, and I can offer suggestions to people who need that advice. And so I suggest that you seek out senior people to get that advice. As I mentioned, sometimes we forget that, in fact, there are multiple reasons to write a proposal. I mentioned learning what's happening in your field, obviously receiving funding to do that work, but it's also an advertisement for your work, in the sense that when I started out and I would be at my poster, people would come up to me and talk to me about my work, and I realized they knew more about me than was on my poster. And the reason is they were reviewers. And so it's important to engage with colleagues and investigators at meetings, and make sure that you understand as you submit something, this is what they know about you, and know about your work. So it's in some of our fields, the communities are not that large, and I think that it's important actually to interact with reviewers regionally and nationally in terms of both getting advice and being engaged with them. Finally, I'd like to think of writing these proposals is really inseparable from your ongoing research. It's a continuum process by which we have funding to be able to continue a research program. But having this be part of that creative process is something important to think about, making sure that we have the preliminary data, for example, that logically leads to our specific aims, and that it is entirely clear in the presentation. And finally, the 10th point is actually enjoying this process, learning to enjoy it, because in fact it's integral to everything that we do. And I'll stop here and ask Robin to give a presentation about some specifics in terms of what could be available to you. I think we have a moment if there's a question or two, but we'll have time afterwards as well.
Thanks, Dr. Dubinett. We will leave time, and I'd like to invite people, if they would like to put questions into the chat, but we'll also have an opportunity for people to ask questions verbally. I think we're on to Ms. Faria. Thank you.
Oh, thank you. Okay. Yeah, so I'm going to talk a little bit about, those of you that are interested in submitting these grants, what are sort of the resources that you can access within the CTSI that can help you, including the grant submission unit, but also some of the other resources that we offer as well. So don't worry about the slide. I'll show it again at the end. We can send it around, but this is just a quick screenshot of all the different types of support or services or resources that are available that I think are particularly relevant to those of you applying for grants in particular. So one of the really great tools that we have on our website is our Successful Grants Library. You can request access to this, and it allows you to see different kinds of funded grants that have been submitted by other PIs on campus. So anything from, really complex U54s to R01s. There's a bunch of K applications and some diversity supplements as well. And so these are great if you are really just getting your feet wet and just want to see what a good, successful application looks like. There's a wide variety of different projects available for you to look at. For my own office, the grant submission unit, we are an administrative team that's available to help you put together your grant. So we sort of see the grant as a sort of life cycle, right? So our goal is to really help you throughout that life cycle at every stage that we can, to help create the best product that you can. So I like to say that we like to customize the type of support that we provide to investigators based on what your particular needs are, the specific requirements of the funding opportunity that you're applying to. So there's sort of a whole suite of services that we provide, but what your needs are sort of dependent on what we can provide. So I'm going to highlight a couple of examples of those types of things that we can provide for you. So one of the main things is just project management, essentially. So the sort of standard application components that you need to put together on almost every grant: biosketches, letters of support, org charts. We have a huge library of boilerplate for all those sort of ancillary administrative documents so that you're not always having to reinvent the wheel and rewrite everything. If you just need to see what a multi-PI plan looks like, chances are we've got a couple on file for you to look at. Editing and proofreading we provide. And this is really just, looking at your grant application as a whole and really looking through, are you responsive to the funding opportunity announcement itself and the different things that it's looking for? Is it responsive to the agency's own requirements and interests? And, is your argument clear to an outsider who's reviewing it? Is it consistent across its different components? So if you're, proposing something in the research strategy, but there's nothing in the budget to back it up, does that create a problem? Or are there letters of support that can kind of bolster the claims that you're making in your research strategy? So we're kind of looking at it holistically in that way. Administrative support, including project management. So if you approach our office, you have a funding opportunity that you definitely want to apply for. One of the first things that I'll do is assign a project manager for my office to essentially be your single point of contact, and they will develop a timeline for you, a checklist of all the items that are required for your particular application. If you have the need for it, coordinating those ongoing like check-in meetings. Sometimes we'll just have a 5-minute Friday check-in call. We just call and make sure that you're on track. And if there's things holding you up or questions that you have, you can help address those so that we sort of stay on our timeline for an on-time grant submission. Site coordination. So if you have an application that involves multiple sites, maybe you're enrolling at different hospitals or you have subaward sites for different components of your application, we can essentially be that single hub that coordinates all of the collection and review of all those documents that need to go back and forth across different sites. As you're working through the application, a lot of times there's just general questions about what does this requirement mean? Or have you ever seen something like this before? And we can kind of help address some of that with some of our expertise and help kind of guide you through some of the intricacies of the funding agency requirements. So some good examples would be, all the human subjects and clinical trials requirements for NIH changed a few years ago, and they're still kind of complex when you get into them. So sometimes there's questions around those types of things. At the kind of earlier end of the application process, if you're just looking for funding opportunities, or you're really having kind of struggling with finding funding opportunities that kind of fit your interests, we can help try and identify different funding opportunities, different funding agencies that might be of interest to you, and then also helping connect you with all of these other CTSI services that might be beneficial for your application, and then tying that all in with letters of support to kind of back up those collaborations and things like that. So one of the questions that I get a lot is, how are we different than my fund manager? And we really see our office as really complementary to the PI and fund management or staff team, whoever you have within your department. So essentially, your fund manager is still going to be responsible for putting the budget together, submitting the grant through your department. And we're really just coming alongside you to help get those documents really tight and clean and responsive, working with the checklist and the timelines and making sure that everybody knows what their job and responsibilities are. And then it's really anything in the sort of pre-award phase for getting that stuff together. So with the grant submission unit, like I mentioned, there's lots of other opportunities within the CTSI as well that might have additional support that are related to grant submission. So one of those is some of these junior faculty programs. So the CTSI offers K and R workshops throughout the year. Many of these elements are actually available online as webinars, which I found really helpful. I've listed just some examples of some of the topics that I think are really great for early stage investigators looking into their first independent application. The K Scholar Society is also available as well. So it helps walk you more in depth in some of these aspects. So if you really need more information on how to, write a rebuttal letter or something like that, you can access these on our website, which I'll link to at the end here. Special Populations is a program that offers a couple of different services, but one of the best ones I wanted to highlight is they do these sort of mock studios or what they call pre-submission grant reviews. So if you approach them with enough time, and I believe the minimum is 6 weeks ahead of your deadline, and you have a draft narrative put together, they can actually pull together a mock study section for you of people whose expertise might match what you might get in a review. And they will, look through your grant and then offer you critique and feedback on how to improve your application for the actual submission to NIH. Again, there's timeline limitations with that, so you definitely want to plan ahead for this, but it's a really great service for those of you that are interested. And in particular, they are looking at special populations, meaning like pediatrics, geriatrics, and underserved populations. So if your application deals with any or all of those patient populations, then this is definitely a service that you could look into. Our community engagement program also offers consultations. So if community or patient engagement is a key component of your application, or you're working with a funding announcement that explicitly requires or encourages this, they can help brainstorm with you about how to create really strong and ongoing community engagement, both for your particular project, but then ongoing throughout your career as well. So that is available to grant applicants as well. So for those of you that might be proposing clinical trials, our ResearchGo website has a ton of information on things from study activation to regulatory requirements. There's some FDA guidance on there. So really just, once you're ready to get started with a clinical study, the resources can really help you from sort of study inception to conclusion of the study itself. So it can be a really great resource for putting together protocols, and they have templates available as well. So a great resource. Now, if your clinical trial is also a multi-site clinical trial, we also have the Trial Innovation Network, which is funded by NCATS, but is available through your local CTSA, which is us. And so we can help connect you with the broader services that are available at the Trial Innovation Network. And they provide particular services that might be needed for multi-site clinical trials, like single IRB. If your study is funded by the NIH, they do require you to have a single IRB plan. And so they help you implement that. They have tons of resources, including community engagement studios, study consultations. So there is a lot that they offer to help kind of get you over the kind of coordination challenges of some of these types of multi-site studies, because they do require so much more coordination and thought ahead of time. So we We have a special email website set up. So if you are interested in these things, feel free to contact me and we can help connect you with the appropriate TIN service that you might need to access. So again, here's a slide. This highlights some of the things that I've talked about, the contact information for each of those things. And again, we can send this out afterwards. You don't have to write it down. But actually, I'm going to stop sharing my screen real quick because I think I don't see the slides that I actually wanted to show you guys about a different thing. So Dr. Dubinett had mentioned that it might be good to talk with you guys a little bit about the changes that have happened to the biosketches and other support documentation. And so I really wanted to make sure we talked about that really briefly because there are some changes that are coming up that are creating a little bit of questions and complications from other investigators. So I just want to make sure that I get the right slides for you guys. And sorry, I'm just going to share it again. Okay. So biosketches. I'm assuming most of you have biosketches and they're ready to go. And so I'm just going to talk about the major changes that have happened. So as you may have seen, a notice came out that these changes were implemented for applications on or after May 25th. NIH came back and said, but we're not going to enforce it until January 25th. That's a typo, but it's 2022. And so at this point, because we're in this in-between time, it's really up to you to decide whether you want to make these changes now or wait until it's actually going to be enforced by the NIH. So I'll talk through each one of these pieces independently just to go over it briefly. So for those of you that have investigators on your application, the NIH is going to start requiring ERA Commons IDs for all key personnel, not just PIs. So I'm assuming most of you probably already have your own IDs already, but if you have investigators who have never been a PI before, never been a co-investigator, chances are they might not have one of these, and it will be required soon enough. The personal statement where you list your qualifications, you can cite for publications, is now getting an additional component because Section D, research support, is being eliminated. So this is where you would traditionally list like all the grants you had, the start and end date, project title, PI name, all that information. So now they're saying that section's going away entirely, but you have the option of highlighting projects from that section in your personal statement. So there's no guidelines on the limitations of that. And I've seen different kinds of techniques popping up. So, most people I would say are just taking the entire section and copying and pasting it into section A. That's the easiest thing to do. Some people are choosing to really curate that list and make it really specific for each application. So if you're applying for a training grant, you want to just show your training awards rather than everything under the sun that you have. So not a major change, but the way that you approach it may be different. Section B is the major change is that they just renamed it. So it's now called Position Scientific Appointments and Honors. And the key word is scientific appointments. So this is encompassing what I'll talk about on the next slide regarding other support changes, but they're really looking for you to talk about any kind of domestic or foreign appointments that you have, including affiliations with foreign entities or governments. And this is, unlike positions, this is regardless of whether you get paid or not or have effort, regardless of whether it's full-time, part-time, voluntary position, et cetera. It's just if you have an affiliation, this is where it would go now. The other major change is that they want things to be listed in reverse chronological order now. Those of you that have submitted multiple applications will know that NIH has never checked for this before. So I don't know how strict they're going to be about that change, but it is something that we're looking at now just because it was pointed out as a new regulation. So along with the Biosketch changes that are upcoming, the other support documentation for NIH is also changing on the same timeline. So again, sorry for the typo, it's 2022. And the one thing that's not changing is you do not have to submit these with your application. It's really only requested during the just-in-time period. So for most of you submitting applications now, you're not going to have to worry about this for another few months, but something to start thinking about because they have pretty dramatically increased the complexity of this document. So now, instead of just looking for you to list your active and pending support, they also want you to include completed support in the last 3 years, and clarifying that when you list your person months, it has to be for each year, starting with the current budget period that you're in. So if you think about it in terms of like a table, it would be like year 1, year 2, year 3, but starting with whatever current year you happen to be in, because we all know person months can change over time. So there's a new section called in-kind contributions, and these can be anything like office space, lab space, equipment, employees that you have access to, if you have students that are supported by an outside source, et cetera. Those things need to be described and included. NIH has a very detailed FAQs website that outlines the guidelines for these in a lot more detail. I don't think we have the time to get into the specifics, but it's really things that you have access to as a researcher that are not directly involved in the particular application that you happen to be involved with at the time. I will say for both the research support that you list in-kind contributions, they are asking you to list the total award amount, both direct and indirect, for the entire project period, meaning like all 5 years if it's a 5-year grant. If you are the sub-awardee, they're only looking for the sub-award amount that you receive at your institution here. If you happen to have any of what they call foreign component or foreign appointments, they are requiring that you include copies of those contracts translated into English if needed. And again, the FAQs on the website go into much more detail if this happens to apply to you. The other big component is that the other support documentation must be signed by the investigator. So there has to be a little signature page on it now. The FAQs indicate that NIH is eventually going to put the other support documentation on their Science EV web system so that you can electronically sign within that system. It's not there yet though, so for now it's really just inserting your signature onto the document. And then they, it doesn't have to be an original, but you do have to keep the originals on file in case NIH asks for it. Okay, so I think that was it. I forgot if I mentioned biostats. I feel like I skipped this one, but biostats also offers biostatistical consultations for those of you that are applying for grants and need that as part of your component. But I'm going to go skip the stuff I already talked to you and go to the end. So this is a link to our website. So we have most of this information listed on there, as well as a bunch of boilerplate templates, guidelines for NIH and NSF applications in particular. There's a section on human subjects and clinical trials. So if you want more detailed information about any of this, you can visit the website and gain access to it there, as well as links to the Trial Innovation Network. And then, as always, if you have any other questions about these, feel free to email us the email address here or give me a call. And if we have time, I'm happy to take questions as well.
Thanks for a lot of great information there. There is a question in the chat. What's the NIH's reasoning for eliminating the research support section? So what I've heard from the NIH, I went to their workshop probably a year before this guideline changed. And I think there was a sense that two things. One is that it's a bit duplicative with the information that you're going to be submitting in your other support documentation, because essentially you're listing the project title, the PI, start and end date. So a lot of that information is already going in to NIH in some other format. And rather than eliminate it entirely, it's really, I think, I think in their vision, simplifying the form so that you can still include the information if you like, but you're putting it in your personal statement. So instead of having to list everything that's related, you can then choose to maybe only highlight the 3 most relevant research that you have, kind of what they do with publications, right? You don't have to list all your publications anymore.
It's really, you can choose to highlight those that are the most important to the application. And so it's giving you a little bit more flexibility to show what you think is important. Although I think there's some debate now about what is considered important. You know, is it important to show things relevant to the application or to show that you have a wide history of being successfully funded? And I think we might be seeing some more clarification from the NIH in the coming months about what that means as well.
Thank you. A lot of nuts and bolts here. So any other questions? If anyone would like to, you can raise a hand if you like, or just go ahead and shout out. If not, I think over to Dr. Smale.
Yeah, thank you. And great presentation, Steve and Robin. That's really, really helpful for, I'm sure, for the whole group. Just to follow up on that issue that was just discussed, that I haven't read the specific instructions and what is expected to be included in the remaining sections of the new Biosketch. But there are a couple interesting angles in this. One is that you know, it's like, do those other sections then require you know, some indication of other funding support and other grants, and if it doesn't, then that really means that the study sections will, you know, the review panels will no longer be able to identify potential overlap with other funding sources. So and maybe what the NIH is thinking is that that's now entirely an administrative function post review. You know, whereas in the past, that it was always something that was, you know, discussed post review by the council and NIH program officers, but study sections often would identify, say, this, this proposal looks really similar to what what another funded grant is like. And I don't, do you have any comments about that issue, Robin, or do you know any, is that correct, or is the instructions for other sections expect that to be there somewhere?
Yeah, I mean, I think you make a great point about looking at making this more of an administrative component rather than giving it to the reviewers, because the other support guidelines are now so specific, and you have to be so clear about how much effort you have each year, how that changes year to year. And so it certainly seems like they are taking a more critical eye at that, but they're extracting it out of the review process, right? Because other support's not submitted until after you've already submitted your grant. And so it's sort of like they're sort of separating the question of the potential overlap and having that process be done at a later point, but also being more critical of that, right? Like making you really be clear about, if you have overlap in effort and amount, the foreign component thing, so I think what you're saying makes a lot of sense, and I'm guessing that's probably what they're doing.
Yeah, thank you. Yeah, so it's not clear exactly how that'll play out, because there still will be times when reviewers will suspect overlap or be aware of it. They can all have some knowledge of other support from just doing an NIH reporter search for the applicant. So it'll be interesting to see how this plays out. The other thing I wanted to say about that is that this detailed other support document, you really need to take that seriously and disclose absolutely everything. That it really is moving away from the realm of the scientific world, where there's often a lot of forgiveness of saying, well, I forgot, or I didn't think this was relevant to put in there, and so I didn't include it. Where they're asking you to sign it, that they really want this to be a much more formal legal document, that if you fail to disclose something that they feel is significant, even if you don't feel it's significant and apologize for it, they could hold you legally liable for that, as we've seen over and over again from reading newspapers or websites that's from foreign engagement issues. So really, really important to be to realize that that there's legal liability for failing to disclose something there. Okay, so but that's getting back to the main point. I think that the presentations were great. I just wrote a couple notes down about things that I wanted to highlight from things that I've seen, and in particular seeing young faculty and in particular physician scientists, which I think are most of the young faculty on this call. And one is the issue of needing to, that yes, it's really, if you're at a junior faculty stage, it's really important to submit multiple applications and try to get funded. But it's also important to really keep a healthy balance between submission of applications and actually doing the research and writing the papers for the research that you've done. So young physician scientists in particular are often under so much pressure from departments and divisions to get funding that they start applying for everything in sight. And then that often will take away from, substantially from the research and publishing research results. And so you really need a balance there, because if you, that as you continue the research and publish, then you become more and more competitive for funding. So if you're sending out some applications and they're not getting funded, it's not that the solution is not always to just write more applications for more funding sources, but actually to potentially say, well, would I be better off staying in my, mentor's lab if I'm a physician scientist and still working with a senior mentor for a longer period of time and getting more results, getting more papers published before I try to become independent and put more effort into writing applications. And so, having guidance from senior faculty that, who can help with that balance, but also just recognizing that there needs to be a balance is really important. A second issue is that, as Steve mentioned very appropriately, think outside the NIH box. So don't always just rely on the NIH, but on the flip side, the NIH is a really, really important target because the grants, as opposed to many foundation grants, although not all, NIH R1 grants are long. They're 5 years. They really give you time to do a significant body of work that will support the next application. The dollar amount is usually relatively large. And additionally, that what I think often isn't recognized is that although there's often a fear of the NIH, thinking that, oh, this is, everybody's going to the NIH, it's so competitive that, especially for early stage investigators, it's often easier to get funding from the NIH than from other sources. That the pay lines at many foundations now are significantly lower than at the NIH. So that doesn't mean to avoid others, but really think carefully about the balance and the numbers, and don't think that I'm just going to apply to foundations that don't have enough to go to the NIH yet. From having sat not too long ago on lots of NIH review panels, that the NIH review panels and the NIH administration is bending over backwards to fund early stage investigators. The early stage investigator applications, as many of you probably know, are separated from the applications of other more senior applicants in the study sections, and are reviewed separately. And the committees I've been on, and I'm sure it's representative of all that that the review panel is saying, okay, this is the new investigators. We want to fund anybody in this group that we think has put together a competent application. So getting those early stage applications is, if there is a competent application, is not all that difficult, and everybody really wants to get those investigators funded. Which brings me to the next topic, which is that those applications do need to be, still somewhat well written and well laid out, and that's a process that involves the most important thing, I think, is to make sure you don't rush it, that you don't write an application and say, I got a deadline in 2 weeks, I'm going to start writing the application, and maybe I'll send it to a senior mentor to read 2 days before it's due and ask them for comments, and then I'll incorporate their comments. That doesn't work. It's not enough time. That, that's starting, a few months before a deadline, writing the application, getting it to a, your completed draft to a, or even doing the specific games first and then a completed draft to someone, a mentor who will really take the time to read through it and provide detailed critiques. 2 months in advance is a month and a half in advance. No, I would say no less than that, because if somebody's going to read it thoughtfully and you're just writing for the first time, there's a good chance it's going to come back with a, you're way off base. You got to completely, it's way too dense. You got to completely rewrite the background section, something like that. There's a lot of logical flaws in the experimental design. So that, having that critical feedback, that if if it's written well in advance, you have somebody and you work hard to find somebody who will take the time to read through it for logical consistency, clarity, and having plenty of time to go through a big revision, then more minor, tweaks, that again, if it gets to the the review panels for early stage investigators are very forgiving, and they're really trying to be forgiving, but it still needs to be, they need to have something to work with. I mean, there's so many times I've been on a review panel where you look, you've got the review panel has 8 early stage investigator applications, and at the end of the day, the review panel saying, gosh, we have these 8, we really want to support these, but there's only one of them that we feel is not severely flawed, and so we just can't bring ourselves to doing it, and that all again just relies on getting it written well in advance, not rushing it, having well critiqued before it gets to the to the review panel, and then you'll be in good shape. And in terms of the application, the last thing is just that it's all about, and again, your mentors who are reading it will probably say the same thing. It's about telling a story, that that it's the goal is not to make it the application enormously dense with every imaginable detail, thinking that, well, what if the reviewers think of this? What if the reviewers think of this? So let's put in every just make it really, really dense with covering every detail. But that's usually not the right approach. That that the reviewers are much happy. They want applications to be readable. They they have a lot of applications to get through. They want to be able to read through your application, understand the state of the field at the current time, what you may have already done, to set yourself up within that field. Know that what you're proposing to do is really important for the field to advance to the next step, and that you have a reasonable plan to get there. So it's not about tremendous detail. It's telling a story with very clear logic, going from where the field is now and its background to what you've done to get started and what you propose to do in the future. And for the preliminary results section, that that another thing that I see with is a sense that from young investigators, that by preliminary results, what they're looking for is results that are that I've obtained in my laboratory, independent of my mentor, that are not yet published, that are driving the project. And that's not at all true. That in the preliminary results section, that it's really still part of the story, that the data that you may have published already in the field, that is that is kind of supporting the path toward what you're going to do, that's all preliminary results, whether it's published or not. And it's also preliminary results, whether it's done within your mentor's laboratory or whether it may have been done after you may or may not yet have moved to your own independent laboratory. So really, that you think of that all as preliminary results. Sometimes there will be a technique that you're going to propose that you haven't done before, It's nice if you can show that you've been able to do that technique, or you've at least engaged, that you can also often solve that just by engaging a collaborator that has a lot of experience, and have them write a letter of support and say you're going to rely on their expertise too, because they've done this, for a million years and know exactly how to make it work. So those are just a few of the key things that came to mind that I don't think were covered, and glad to open it up. We got just a few minutes for discussion if there's any questions.
Yeah, thank you, Dr. Smale. What a terrific program. I don't see any questions in the chat. Would anyone like to raise a hand? I'm looking, or even just yell it out. Turn your microphone on, and with any questions or comments.
Hi, this is Pejman. This is kind of maybe to some extent relevant. I was wondering, how is it, how are our 7 research themes help or hinder, or in a way facilitate the process for the review? Does the infrastructure or tying our research to the 7 themes would be helpful from the eye of the reviewers?
I don't, the reviewers are going to, in a review panel, are going to be looking at the science that's in that particular application. For team science applications, certainly having being able to point to a broader structure is helpful. For an independent application, there is a section in the applications that asked about environments, the institutional environments, and in that section, it can certainly help to highlight that there's a great community of people that may be working in a particular area. And also for people that are working in having trouble finding somebody with expertise to critique an application in advance, feel free to reach out to a theme leader and say, can you suggest someone who may be good for me to talk to about this particular direction I'm moving, that I just don't happen to know anybody in that area.
Thanks.
Well, that takes us up to the hour. So I really thank the presenters for a fantastic session. Regarding coming attractions, the final program for the academic year will be from Dr. Azarmina, who is just speaking, self-awareness, self-assessment, and self-care for busy faculty members, one that I'm looking forward to, which will be next week on June 15th. So with that, thanks to everybody who attended, thanks to everyone who spoke, and have a nice rest of the day. Thank you.